So I tried making a live video yesterday, and the audio for the first story was shit, so I'm going to redo it. So the Washington Post has a story. The new HHS Civil Rights Division to shield health workers with moral or religious objections. So get a load of this. The Trump administration will create a new conscious and religious freedom division within the Health and Human Services Department to ease ways for doctors, nurses, and other medical professionals to opt out of providing services that violate their moral or religious beliefs. The new policy is aimed at protecting healthcare workers who cite those reasons for refusing to take part in abortions, treat transgender patients, or participate in other types of care. So basically what this is saying is if you have a moral objection to any life choice of a patient and you're a healthcare provider like a doctor or a nurse, you can deny somebody care because of that. That is the fact that Donald Trump's administration is even pushing to do that is absolutely mind-boggling. So it goes on, by empowering enforcement authority, the action will reverse policies put into place under President Barack Obama. Well, that pretty much explains it, doesn't it? And resurrect and expand conscious protections introduced under President George W. Bush. The new division, which will be part of the HHS Office for Civil Rights, will not only accept complaints from healthcare professionals, but will be responsible for ensuring that hospitals, clinics, and other institutions across the country are accommodating to their beliefs. Not the beliefs of the person who needs help and is sick and is looking for treatment, the beliefs of the doctor. So this is obviously a thinly veiled way to try to attack abortion rights and LGBT rights via religious liberty laws, like we've been seeing pop up throughout the country in different states. And religious liberty is basically code word for, I want to be able to discriminate against you. My personal beliefs, it's not that I have a problem with you. It's just, my personally held beliefs are so important to me that I just can't give you service because, it would just violate the code I have lived my entire life by. Oh, well, guess what? Doctors take this thing called the Hippocratic Oath. Anybody ever heard of that? I'm sure everybody who's ever worked in medicine has. And it means you cannot deny somebody care based on anything. Like, it ends saying, I will never turn away somebody seeking help. That's the gist of the Hippocratic Oath right there. I won't play God. I won't insert my own personal beliefs into being a doctor. I will treat everybody with dignity and decency and like they're a human being, like a person, kind of like the thing that you and I are, whoever's watching this. So that's absolutely insane. Now, they had somebody who was the head of this Office of Population Affairs within the Health and Human Services Division, and her name was Teresa Manning. She was actually resigned or let go last week in a very strange kind of way because she was escorted off the premises by security guards. Like, this is not the first Trump official that's had to leave their job, with security guards holding them by each arm. Like, oh God, okay, fine. I'll leave. Shit. But guess who Teresa Manning was backed by? Of course, it would be pro-life organizations like the Family Research Council. I mean, she is funded by the Family Research Council, appointed to the Health and Human Services Department of Population Affairs, and she's basically using all of their talking points, the Family Research Councils, to push policy that affects Americans. Now, if you're at the Population Affairs Office, wouldn't your main job like the main focus of your job being things that influence populations. So what would those things be? Off the top of my head, I would say family planning, abortion, and contraceptives. And access to medical facilities and programs like Planned Parenthood are essential for low-income areas where people may not have health insurance. I believe 46% of people who have abortions actually have health insurance but decide to pay out of pocket. There's a lot of different reasons why you wouldn't use health insurance, but Planned Parenthood, for instance, by giving contraceptives, just imagine the amount of abortions they actually prevent. Because only about 3% of their businesses or their services go towards actual abortions. This is very important and seldom brought about on the right. 3% of everything Planned Parenthood does has to deal with abortions. And not a single federal dollar can go towards that. Now, states can actually set aside funding for abortions, and that's okay because of the Hyde Amendment. But federal dollars, no, your federal dollars are not going towards abortions, guys. Now, Theresa Manning, after she stepped down, she was replaced by a temporary head. I'm not exactly sure. I had it written down here somewhere. And they're going to continue their assault on women's reproductive rights and contraceptives. But get a load of these numbers, because once I tell you these numbers, you'll see why this is such a big deal. So if you took away access to contraceptives, if you were to shut down Planned Parenthoods, well, in 2015, which is the last data we have, 822,000 pregnancies were prevented by birth control from these organizations. Out of those, 387,000 were unwanted pregnancies, and 278,000 would have been abortions. So you saved 278,000 abortions from occurring. I can't think of a single right-wing policy that saved that many abortions from occurring. 278,000 a year. And that's in 2015, so we can only assume it gets higher. So if you're pro-life, and I know it's a touchy subject, I'm totally aware of that, and that's cool. You can be pro-life, and I get it. But if you are pro-life, you should be pro-contraceptives. That shouldn't be a hard one for you at all. Because right there, you would save 250,000 abortions a year by not limiting access to these.